name is Madelyn Endrijaitis, and with the help of Mystery and my handler Amanda, I will be demonstrating a horse health check. A horse health check is a series of tests performed on your horse to determine if he is happy and healthy, or if he is having issues that we are as yet unaware of. Now, you should do regular health checks on your horse to make sure that no new issues have popped up since you've last checked him, especially since some of the more serious issues and illnesses cannot be seen, but can be shown through changes in behavior and through changes in the horse's vital signs. It's also good to do regular health checks that you get used to your horse's normal behavior and its normal health parameters. Knowing what is normal for your horse can help you to determine if there is an issue more quickly than if the horse is a stranger. The first part of your health check is to assess your horse's overall appearance and behavior, checking for anything that is abnormal or out of place. You want to do a brief nose-to-tail inspection of your horse's physique, checking that the eyes are bright and that your horse is alert and paying attention to what is going on around him. You want to make sure that he is standing comfortably and not showing any visible signs of pain. His coat should be shiny to show he is getting good nutrition in his diet, and he should have no new signs of swelling or cuts on his body. You also want to take this time to assess your horse's behavior. Is he acting normally? This is where knowing what is normal for your horse can really come in handy. For example, let's say that you have a horse that normally greets you at the front of his stall when you arrive, but today he's standing in the back of the stall with his ears pinned. This may be a sign that he is injured or sick, and you should do a health check immediately. Now, looking over your horse with your eyes is really easily done, and therefore should be integrated into your daily routine. You should do this whenever you go to visit him at his stall or go to feed him. Your horse's behavior can be your first warning that something isn't quite right with his health. Some horses will display behavioral changes much more than others, so you should always be aware of what is normal for your horse. If you are working with a horse you are unfamiliar with, it is a good idea to have a working knowledge of horse behavioral traits to fall back on. For example, if all of the other horses in the barn are nickering and kicking their stalls for lunch, but this horse is laying down in his stall, he could be having a very serious problem. Once you've assessed your horse's appearance with your eyes, you want to do the same thing with your hands. Running your hands down your horse is a good way to check for things that you can't necessarily see, like slight swelling or heat. You want to make sure that you're checking your horse from nose to tail, including the legs. You especially want to check for any tenderness, open wounds, and new swelling that your horse may have. You want to make sure that when you're checking your horse from nose to tail, that you also check both sides, which is why my handler Amanda will be turning Mystery around, staying on the same side as me for safety purposes. Now, just like with the first side, you want to check him from nose to tail, checking for tenderness, swelling, open wounds. If an area is especially tender, be careful that you don't press too hard, or he might kick out at you in pain. Now, it's a good idea to check your horse regularly, especially when they just come in from turnout, as they may have gotten an injury while outside. Now that we've determined that our horse's overall appearance is healthy and normal for him, we're going to do a few hands-on tests to check his vital signs to make sure that he is feeling good inside and out. A horse's vital signs fall within a general parameter of what is healthy for the average horse. However, each horse is unique and may have a different series of what is normal for him than the horse next to him. For example, this horse might have a lower normal temperature than his neighbor would. When taking your horse's vital signs for a horse health check, I have found that it is easiest to start at the horse's nose and work your way back towards the tail. This can make it easier to take all of your horse's vital signs without accidentally forgetting any in the process. So, starting at the horse's nose, we're going to check the horse's mucous membranes, which can be found in the conjunctiva of the eye and in the gums in the horse's mouth. I have found that the gums in the mouth are much easier to check. We're going to be checking the horse's gums for color and moisture levels to make sure that there are no underlying issues. We're going to do this by using a finger to lift the horse's gums and visually inspect them. For starters, you want to have nice, moist gums to show that your horse is properly hydrated. Dry gums can mean that your horse is dehydrated or may even have a fever. You're also going to be checking your horse's gums for color. Normal, healthy gums will be light pink in color. Make sure that when you're checking the gums that you have good lighting, as some lights can cause gums to appear abnormally pale. A horse's gums can be a variety of colors to show what is happening within the horse's body. Each color of the horse's gums is very distinct and specific to the condition that the horse is in. Pale gums could indicate anemia, being blood loss, or shock. Purplish blue gums could indicate cyanosis, being a lack of oxygen in the horse's bloodstream. Fiery red gums could indicate fever or infection in the horse. Yellow gums could indicate jaundice, which is a problem in the horse's liver. It is important that you are able to recognize when your horse's mucous membranes appear healthy and when they don't. The next vital sign that we're going to be checking is your horse's capillary refill time. This is to ensure that your horse is having proper blood circulation throughout his body, as poor circulation could indicate that he is having a serious problem. Just like when checking your mucous membranes, you're going to use a finger to lift your horse's upper lip to see the gums. You are then going to use one finger and press it against the gums until the area under the finger turns white or pale. To test your horse's circulation system, you're going to be using pressure from your thumb to push blood out of that area. The capillary refill test is to see how long it takes for blood to return to the area once your finger is lifted, like so. The blood should rush right back into the area of the gums, turning them pink again. This process should only take 1 to 2 seconds to occur and shows good health and circulation in your horse. The next vital sign we're going to check is the horse's pulse rate, which can be most easily accessed at the horse's external maxillary artery, which is located here just under the horse's lower jawbone. Pulse rate can determine if your horse is experiencing pain or stress, as these will cause the heart rate to elevate. Obviously, a horse that is fresh out of the arena will have a high pulse rate as he has been exercising, so this vital sign may not be as useful if you're trying to detect problems in a horse that has recently been working. To check your horse's pulse rate, you will take your first 2 fingers and find the external maxillary artery. This is easier on some horses than on others. Once you have located the artery, you will take the pulse rate by counting the number of beats against your hand within a set amount of time. It is best if you have a friend around to help you time. We're going to time for 15 seconds, starting when Erin says go and ending when she says stop. While doing this, I will count Mystery's pulses aloud to track his pulse rate. Ready?
Go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Stop.
I got 11 pulses in 15 seconds, which is the equivalent of 44 pulses in 1 minute. The normal resting horse has an average pulse rate of 32 to 44 pulses per minute, which means that Mystery's pulse rate is within the normal range. While the pulse is most commonly taken just below the jawbone, as we've just seen, it can also be taken just below the fetlock joint in the pastern around the ankle area, right about here. This pulse is much harder to distinguish in the horse unless he is having a foot problem, such as a hot nail or laminitis. If you think your horse might be having trouble with his feet, then you should check for a strong or bounding digital pulse. This can be a warning sign of serious and painful problems in the foot. As I detect no strong digital pulse on Mystery, I have no cause for concern with this foot. To be more thorough, you would check every foot the same way that we have just checked this one. The next vital sign we're going to take is for the horse's skin pliability, also known as the skin pinch test. This is to check for the level of hydration within the horse. This is because the level of water in the horse's body affects his skin elasticity. To perform a skin pinch test, you will casually approach your horse and run your hand down his neck, stopping just above the shoulder blade. You will then take a pinch of skin and pull it away from his flesh. You will pull the horse's skin away from his neck by about an inch or so, then releasing quickly and watching it disappear back into the horse's normal neck. It should take 1 to 2 seconds for it to seamlessly meld back into the horse's body and should leave no wrinkles behind. If there is an obvious wrinkle left behind in the horse's skin, this is called tenting. The reason the skin tents is because a lack of water in the horse's body can compromise the elasticity of the skin, making it difficult for the skin fold to snap back into place instantly. If you have a horse with tenting skin, he is likely dehydrated. The only instance where this may not be entirely true is if you are dealing with an elderly horse. As a horse ages, their skin naturally loses its elasticity and can cause it to sag a little bit. This means that your horse's skin may have wrinkles or tents in it, even when they are properly hydrated. When doing a skin pinch test, make sure you consider the age of the horse before concluding that he must be dehydrated. If your horse is an elderly one, you may want to check the mucous membranes instead of doing a skin pinch test to determine hydration. The next vital sign we're going to check is the horse's heart rate. While we did already check the pulse, the heart rate can be checked if you're having trouble locating where the pulse is. To check the horse's heart rate, you're going to need a stethoscope, which will allow you to hear the sound of the heartbeat more clearly. The sound that you are listening for is the typical lub-dub sound that indicates the heart is in good working order. To use the stethoscope, you will place the earpieces in your ears, like so, and you will hold the chest piece carefully, as any noise you make with your hand against it will be amplified in the stethoscope and make it more difficult to hear the heart. You will place the chest piece at the horse's heart girth, located just behind the elbow, right about here. You will need to locate the heartbeat. Once you can hear it, you will want to have a friend time for 15 seconds, starting when they say go and ending when they say stop. You will want to count the heartbeats aloud so that you do not lose track. Ready?
Go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Stop.
I got 11 beats in 15 seconds, which is the equivalent of 44 beats in 1 minute. As the normal horse has an average heart rate of 32 to 44 beats per minute, Mystery's heart rate falls within the normal healthy parameters. The next vital sign we're going to check is the horse's respiration rate. This is the vital sign that is the most easily influenced within the horse by causes that may not be a health issue. Respiration rate can be influenced by excitement, stress, or exercise. A horse that is fresh out of the arena will naturally have a higher respiration rate than a horse that is at rest. Respiration rate is also influenced by pain. A resting horse with a high respiration rate may be uncomfortable or experiencing an issue. You should always try to be aware of if your horse is breathing normally. To take your horse's respiration rate, you need only to observe the flank area as it expands and contracts with the horse's inhales and exhales. You will want to have a friend time you for 15 seconds as you count the respiration, starting when they say go and ending when they say stop. Ready?
Go.
1, 2, 3.
Stop.
I got 3 breaths in 15 seconds, which is the equivalent of 12 breaths in 1 minute. The normal horse's average respiration rate is between 8 and 16 breaths per minute. This puts Mystery's 12 breaths within the normal healthy range. When checking your horse's health, you want to ensure that you check the respiration rate and the heart rate and compare what you got. The respiration rate should always be lower than the heart rate.